choosing on a
All right, so placing sealants and bleaching. Placement of pit and fit, and some of this is, I think we've seen when we showed the pediatric lecture, okay? So we'll kind of go through this a little bit faster. The dentist diagnosis, which teeth would benefit, and sealants you can do in Arizona if the dentist allows you. The key thing to sealants is isolation. What do I mean by isolation? And with that thing that I got, I used it my first time on Friday. Oh man, it's awesome. Yeah. You guys could do sealants. I wouldn't hesitate letting you guys do sealants. Right now, I don't let them do because it's really critical that it's isolated, and even myself doing it by myself is hard. So an assistant doing it by herself, you really gotta be good with cotton rolls and stuff. So you need an assistant to help you. But with that thing, I'm gonna teach Yesenia.
When he used that one,
All right, let's see.
when Mike plugged his computer into that one, it didn't work right.
The battery backup one. Battery's dead, probably. Yes. So yeah, and it's set up in the last room. I can pull one out when you guys are doing sealants right now, so you guys can kind of see what it does. It's kind of the big brand out there is called ISO Dry or ISO Light. The ISO Light has like a built-in light on that mouthpiece. The ISO Dry, it doesn't. It's just a mouthpiece, just like this one. But what I liked about this one is that these mouthpieces you can sterilize, whereas the ISO Dry, they're disposable at $2 a pop. Where these, you can sterilize. These are 50 cents a pop, and you can sterilize them. The guy said up to about 30 or 40 uses.
Oh, wow.
And then it starts to change colors, and then you pitch it. So 50 cents for 30 or 40 uses. Can't beat that.
Not at all.
So you guys will see it. It's set up on the last room, and I'm going to use it a few more times. The patient said, "Oh man, that thing is great," and I did a crown on that patient. You know, Jessie was like, I go, "Jessie, you can go check your email." She was like just standing there. You know.
Yeah, we don't really need her.
Yeah, for the cutting procedure, she was just standing. She had the saliva ejector, and she was retracting a little bit, but I just started making fun of her. "Oh, Jessie, it's like, you can go do this, you can go do that," and the patient was like laughing. Pretty interesting. But it's a really neat thing. I think I'm going to use it a few more times, and then if I like it for all the other procedures, I'm going to get it on the other operatories. But again, the dentist diagnoses which teeth need it. Posterior teeth that are newly erupted or caries-free benefit from sealants. Sealants may be placed by the dentist, dental hygienist, or assistant, depending on the laws of the state. And in Arizona, you guys can't put sealants. Okay, so what you need is the basic setup: air, water, syringe, rubber cups, low-speed handpiece. Flour of pumice is just the gray pumice to clean the tooth. The big thing is that you need prophy paste or paste that does not have fluoride, because fluoride kind of inhibits the bonding of a resin. Okay, so you don't want to use the cleaning paste that's in the little cups to do the prophy, because that has fluoride. You want to use the gray, bad-tasting stuff, and that's just like sand. And we've got it in the rooms there, so we'll talk about that. You need etch, just like for your composites. You need the material you're going to seal with, a brush, a light curing unit, and then articulating paper and floss if you need. Procedure, again, you're going to use the flour of pumice, and you're going to pumice the tooth on the surfaces that you're going to be doing. Okay, and we're going to go over polishing. You're going to apply the edge. Okay, make sure you're careful with the edge. Don't bring it over the patient's eyes. Come down underneath, or make sure your patient has safety glasses. You're going to put it with an applicator or from the syringe, depending on what you feel comfortable with, on the biting surface, or pits and fissures. So the molars have a buccal pit, usually. If you see it, you're going to etch the occlusal and etch that buccal pit. Okay, so once you etch it, rinse it, you're going to see it turn kind of frosty, and that's where you're going to put it. But be sure to seal that buccal pit as well. Rinse well the teeth, let's see, 20 to 30 seconds. Dry the tooth. The etched surface should appear chalky or frosty. If the tooth does not have this, you've got to re-etch. And on the mannequins, it probably won't do it as much. Somebody needs sealants. We can do sealants on you guys so you can see. Prepare and apply the sealant material according to the instruction. And the big thing is you don't want to overfill it. Because if you overfill it, you're going to get this. You're going to get an interference. Okay, so when the patient bites down, it's going to hit on that sealant. The sealant is not really a strong material, so it's going to what? Break. And if it breaks or chips, then what's going to happen? You get bacteria that goes through that fracture, and you're just going to make things worse. So the key thing is don't overfill. You want it down on the pits and fissures, just right down as deep as you can so that the patient bites and he's not hitting on that. Okay, so you do need to check the bite after you do it to make sure that it's not in function, because if it is in function, it's going to fail. The patient will come back in 6 months or a year, you're going to have a cavity underneath that sealant that tooth really didn't have anything. This is the other one, to hold the light 2 millimeters directly above the biting surface that you're sealing. Okay, don't hold your light way up here. Use the shield and look. You want to be right here. If this is the tooth, you want to have your light right here, 2 millimeters above it. Okay, almost touching it. So get a good rest, a good fulcrum, and make sure you cure it. And depending on the light system you have, you're going to cure for 20 to 40 seconds. My light, you hit it for 2 seconds and it's done. Check the cured sealant. Okay, so after you cure it, you're going to use your Explorer, and it should feel like a skating rink, like an ice rink. It should feel smooth. From tooth to sealant, and from sealant to tooth, you shouldn't catch anywhere. You shouldn't feel any little bubbles or anywhere clicking. If it clicks anywhere, then what's going to happen in that click?
It's gonna fracture.
Well, not fracture, but that click means it's rough. You're going to get bacteria to stay there. So you want it nice and smooth. Okay, so you just slide it across all over, and it should feel nice and smooth. If it doesn't, you need to check it and see if you need to add a little bit or pop it out and redo it. Dry the teeth, and you're going to check the bite, like we said, and you do have to adjust. Okay, there's no such thing as you do the sealant and you just let them go. Because if you don't check the bite and they're biting on it, you're doing them more harm than good. Because it's going to fracture, and when they come back, they may have a cavity on a tooth that didn't have a cavity. Again, those are the fissures that kind of travel down into the tooth. And again, this may be, for me, it may be a little bit too much sealant. I like it just down on the groove. The good thing about sealants, it does have fluoride. Okay, so it's supposed to minimize or decrease the caries incidence. Okay, as long as it's kept in good function, where it's not broken or chipped. So even sometimes when you have maybe the beginnings of a little decay there, I'll clean it out and then I'll seal. I don't like to leave any stain if I don't have to, but depending on the patient, sometimes because of the fluoride it won't get any worse. Okay, so here's the procedure. You've got isolation here, retraction. You've got your saliva ejector kind of bent down and underneath the tongue. Your pumice with the flower of pumice, the gray pumice. You etch with an applicator tip for about 15 or 20 seconds. You rinse and dry, and you apply your sealant with an applicator or the little syringe that we'll show you. Then you hit it with a light, again 2 millimeters above this tooth, and again that's probably what you're going to get. we'll do that bleaching, or that's the sealants. Bleaching, we've got some models that you guys poured up of each other. You're gonna trim one model and do one?
If we have time too, it depends on the time.
Yeah, on the
We'll
time.
start with the upper one since that's the most common, but,
Yeah.
and if we don't have time, you guys can always come back and
And
work
trim
on
the
the
bottom.
second one, depending on the time, because it is time consuming.
Or when we do the review, if we don't have time to do the low or something, practice on the bottom.
And what we'll do is we'll let you use your teeth, so you can work on, so somebody took your impression, so you can work on that and make bleaching trays for yourselves if you guys want to use them.
Okay, so home bleaching requires the patient to apply bleaching agent. Usually carbamide peroxide is the chemical that's used into a custom tray. Many different types of materials are out there, and I mean, you see infomercials on TV all the time. Armamentarium, again, basic setup. You need alginate. Why do we use alginate and not polyvinyl siloxane? What's polyvinyl siloxane? Vinyl impression.
It gives you a more detailed impression.
Yes, from the back. Exactly. We don't need that much. We don't need that much detail. We just need a study model, basically. So it doesn't have to be exact for bleaching trays. We want, you know, some accuracy, but not down to the every little nook and cranny detail. So alginate impression. Star. Alginate for bleaching trays. Rubber mixing bowl and spatula impression trays, custom fabricated vacuum form trays, home bleaching kit. Well, how do you measure your impression trays? What do we need? How do they need to fit? How do you know if they fit?
3 millimeters. Did 3 millimeters.
Okay, 2 millimeters distal to the most posterior tooth. And preferably a little bit larger than try to go a little larger than too small. One saw treatment is complete, alginate impression. Oh, one saw treatment is completed. So we can't do bleaching if the patient has cavities. So the patient comes in, I want their teeth bleached, have an exam, cleaning, and make sure all the cavities are free, are gone, or restored. Then we can bleach their teeth. So we take alginate impressions and take a maxillary mandibular arches, and we schedule them back in about a week or so. We pour them into stone. You've done that. Vacuum formed. This is what you're gonna use. You put a plastic on a machine. You're gonna heat it up. It's gonna soften. You're gonna turn on a vacuum and put it down, and it's gonna suck it right on that model. Then you're gonna trim it. Okay, so there are your alginate impressions. There you get your models. You kind of trim the model. This is what Dr. Cervantes is going to show you how to do. Make sure you don't have bubbles or anything here, because when you do your suck down, if you've got big bubbles, guess what? Your suck down is going to go around that bubble, and when you put it onto the patient or yourself, it's not going to go down. You want it down just to the gum line. We use, it depends on what doctor you use. Sometimes I use block out, sometimes I don't. You put a little veneer, okay, just on the outside of the teeth. And what that's doing is creating a little reservoir, a little space, so that the bleach can stay there. I've done it both ways, and it works both ways. And then you cure it with a light. So again, you just kind of paint the outside of the teeth with just a thin layer. You don't want to put too much. If you put it too much, the bleaching tray is going to feel bulky, and the patient will say, "Oh, it feels like I've got too much in there." So you just want a real thin, less than ½ a millimeter or so, just a thin coating there. There's a machine. You put your model there. You put your plastic, and once you get it, you trim it. Be careful with your scissors. Don't cut your fingers. And this is kind of what you want, as close to the gum line as possible. Okay, and there's different ways. I cut it right to the gum line. Dr. Cervantes cuts it a little bit different. Again, main thing is you don't want too much out here so the material won't go onto the gums and bleach the gums. Yay. Alright, one more.
Gotta come back and check on you.